Shop Physical Therapy. I'm Dr. Catherine Price, and I'm a physical therapist. The goal of this channel is to provide nutrition tips and physical therapy intervention strategies to improve the quality of your life. You do want to discuss with your healthcare provider your particular problems for the appropriateness of exercises and interventions for you. Today, I want to share how to do trigger point release of the rhomboid muscles. This is if you are having pain between your shoulder blades. So most of the time, you're going to have pain right on the inside of the shoulder blade. You do want to differentiate if that's coming from the neck or from the muscle. When it's coming from the muscle, it can be from trigger points where there's overcontraction from a forward rounded shoulder posture. So there's overload of that muscle, and you want to go in and release that. So the origin and insertion. So you have these bony prominences that stick out. Those are your spinous processes, and it's going to attach from C7. So the one that's the largest, we can start there at C7, T1, T2, T3, T4, and T5. So it's a muscle that is difficult to get to, so I'm going to use some tools to get to that muscle. It attaches there and then, or originates on those areas, and then inserts on the inside of the shoulder blade. The trigger points are located right inside the shoulder blade. I'm going to use different tools to release this. A theracane is an excellent way to get to these muscles. So what you would do is you're going to take the ball of the theracane, and you're going to go right in the corner of the shoulder blade there at the top. And right on the inside, that's going to be the first trigger point. And what I'll do is I'm going to keep the shoulder that I'm going to release relaxed, and I'm going to use the other to take that and press into that area. Usually this is going to be tender where there are trigger points. And I want to hold that there until I feel a reduction in the tenderness. And I want to work my way down the inside of that shoulder blade. So I'm going to go right down and address those muscles on the inside. So you've got your rhomboid, major, and minor. To see those muscles, if I place my hand behind my back and give some resistance here, you should see those muscles. It's going to elevate and retract the shoulder blade. So to release those muscles, I'm going to go and apply pressure, relaxing the arm that I'm releasing and going along the inside of the shoulder blade, finding the areas that are most tender and holding pressure until that reduces. And so if you take your arm and you reach across as you hold pressure, then you're going to put the muscle on stretch and you can release that muscle. So just working your way down the inside of the shoulder blade. So this is one way to get that to that muscle. Another way, I like to use the size of a golf ball, and I'm going to use my body weight to release that. So what I'll do is take that ball and place it right on the corner there and start up high on my back so that my weight is on the muscle. So I'm going to start there. Then I'm going to take my elbow and bring it directly up towards the ceiling. I'm going to then lift my bottom and apply pressure there. That can feel pretty intense. And I'll then slowly work the arm across the body and come back. So I'm putting a little bit of stretch on the muscle as I'm applying pressure. And I'll lift my bottom and roll right down the inside of that shoulder blade and bring the arm across, back and forth to actively release those areas of that rhomboid muscle. And then just working my way down all the way to the bottom of the shoulder blade. And continuing to do that until I feel a reduction in tenderness or pain in that area. So it is productive pain. It is going to be tender to do that, especially if there are trigger points located there. After you release it, to stretch it, you can bring your arm across your body and just allow that shoulder blade to come away from your spine, and that will stretch the muscle. If that is painful, you don't want to do that, but that's just a way then to restore the muscle tendon length relationship after you've released the muscle. So I can stretch that. To strengthen the muscle, I'm going to elevate and retract my shoulder blades. You can do this with a resistance band. So if I want to activate the muscle, I'm going to squeeze my shoulder blades and elevate at the same time. And it's going to be a row. And holding there for a count of 10, 4, 5, 6, 7, 8, 9, 10. Bringing it forward. Squeezing my shoulder blades together, elevating, 2, 3, 4, 6, 7, 8, 9, 10, and relaxing. I can do that for repetitions to re-educate the muscle. So after you release, you stretch and you strengthen. You can help re-educate those rhomboids and then work on paying attention to posture so that they are not overloaded and you do redeveloping those trigger points. So if you are rounded, sitting in a forward position for a long time, sometimes the shoulder hurts between the shoulder blades, and that can be the source being the rhomboid muscle. So that is how you can release the trigger points for chronic myofascial pain that occurs between the shoulder blades. I hope this is of help and have a blessed day. Thank you.